This is the Health Subcommittee of Appropriations, and the purpose of our meeting today is to take public input for the 21 budget. So that's what we're going to be doing. We have a sign-up list that's been here. For anybody who wanted to speak, we have the list here. And all you folks that are standing up in the back, if y'all want to come in and find you a seat toward the back, you're welcome to have a seat and make yourself, excuse me, a little more comfortable. For those of you who have signed up and would like to speak, I'm going to ask you, I'll call your name. We'd like for you to come to the podium. We'll recognize you and like for you to identify yourself and what group you're with. And we're going to ask you to, let's be respectful of everybody's time, and let's limit our discussions to 5 minutes each. We've got a number of people who want to talk, and we certainly want to hear from you, but brief is good. So let's try to limit it to 5 minutes, and if we start getting close to the 5 minutes, I'll give you a high sign and tell you got a minute to wrap it up, and we really would appreciate your cooperation so that we can move along at a reasonable pace and let everybody have an opportunity to be heard. So having said that, thank you all, excuse me, thank you all for being here. And first person who signed up on our list, Damian Scott. Yes, there we go.
Representative Parrish and members of the committee, thank you for hearing me today. I appreciate what y'all are doing. I have learned a lot today already about the task that's before you to balance the budget, so we wish y'all well in doing that. My name is Damian Scott. I'm the CEO of Emmanuel Medical Center in Swainsboro, Georgia. We are an award-winning hospital that struggles every day to make it ends meet financially. You see this yellow button on me. This tells me that I'm a member of Hometown Health, and you see a lot of these yellow buttons in the back. Really, truly, any one of those individuals could be standing up here and could tell you a very similar story. Rural Georgia has very high-quality health care, but one of the challenges that we have is we struggle to make ends meet financially. In this past year, things became, I think, even more difficult for us for a reason that I'm going to tell you about. Periodically and regularly, we have individuals that come into our emergency room with very complex problems. They are facing mental health issues, oftentimes have poverty, so they're uninsured. And at times they're also dual diagnosed, meaning they have a developmental disability as well. Regardless of the state's efforts to place those patients, we have a tremendous burden in getting them placed. It's not uncommon to hear of stories where people have stayed in our ER over 10 days. We had a hospital today mention over 100 days. And so these are incredibly difficult for us. And in this past year, our regulators have said that we've got to have an employee that is 1 arm's length away from that patient. And for our hospital, that's cost us over $15,000 to $20,000 a month in staffing costs as an increase. So when we look at the proposed budget, I would say that many of us are very concerned about budget cuts to healthcare, in particular any that are related to mental health, because we do not want to see a greater burden placed on our rural hospitals because of budget cuts. There's already a burden there that's cost many of us a lot, and when you're barely making ends meet, even $15,000 to $20,000 can be significant, and we certainly don't want to see that number go up. Thank you for your time. If you have any questions, I'd be glad to answer them.
Thank you, Damon. Any questions of Damon from the committee? Representative Petrie has a question for you.
Thank you, Mr. Chairman. Mr. Scott, so help me to understand the degree to which the Community Service Board in your area is helpful to a hospital system, to a rural hospital system like yours. Is the community service board in your area, are they helpful? Are they communicative? Are they trying? What are your thoughts?
No, I think we have a very good community service board. We meet monthly with them and as a mental health collaborative and try to address some of these issues. The patients that we're talking about are incredibly complex, oftentimes violent, and sometimes they don't meet their criteria. That's one issue we have. And another that happened to us specifically is that our CSB merged, CSB of Middle Georgia, but that now has our CSB is in a different region than our GCAL region. And so when they put a patient name up on the board, our local CSB is not aware unless we notify them directly. And even then, it's got to be moved to that board in order to get them placed at our local CSB.
And are y'all addressing that issue to try to?
We're trying.
Because that sounds like a communications and a bureaucracy challenge.
It is. It is.
And I don't want to encumber the conversation any longer, but do you believe that there are adequate community-based services for patients in your system?
No, I don't. I think that oftentimes one of the holdups is that crisis stabilization unit. And so we often aren't able to get people placed because that crisis stabilization unit is full. The need is great. And I'm going to look out at my peers here, but I feel like the need is greater than it used to be for mental health. They're nodding their head. So the need is great.
Thank you.
And unfortunately, it's falling to the ER, and the ER is not the place to provide mental health care.
Thank you very much.
Thank you.
Next up on our list, Steve Neff, and it'll be followed by Dr. Geller.
Mr. Chairman, members of the committee, I'll be working from the sheet. There's the red bar thing here across the top. My name is Steve Neff, and hopefully you all will recognize this sheet. I brought it before you last year. I've met with several of you regarding it before. Today I'm representing specifically pediatric nursing company Bayada. However, I am also representing all of those companies as well. We work in partnership with them in kind of an alliance. Over the past several years, these providers have had a very hard time hiring nurses. So I'm not going to be the only one that says that today, and not going to be the only one that says that for a while. I suspect that's our biggest concern. Within this GAP program, the Georgia Pediatric Program, the waiver that is under Department of Community Health, what that basically is from 30,000 feet is when a child has been maybe at Children's Healthcare, Scottish Rite, then they need to transfer home. These providers basically will set up what is basically a mini ICU in the home. So this isn't just a home care worker coming out. This is a nurse that's there, the same nurse every day, very long hours for very, very sick children that are in crisis. And every time we want to stabilize them and to be able to be there at home. Our problem is as we have less nurses and less staffing, maybe we can't take a child, then they're just having to stay in the hospital, which is costing more money, obviously, to the state and to the family. Or if you don't have a nurse that'll go out that'll be able to take care of them there in their home, then they're having to readmit. As I said, I've met with you all before, but the important part of this as well is that we worked on this for a few years. We were very thankful to you all and to the Senate in 2018 budget, in which we met half of our goals. So we're asking for the second half to try to meet the second half of our goal. The idea is to pass this money as we have directly along to these nurses so we can recruit them and retain them. We were at $40 for an LPN, and we were moved to $42.50. I've got those numbers here, I apologize. So then we'll be moving to $45.50 we're asking. That's for the RNs. For the LPNs, we were at $37.28. We're trying to get to $42.50, which is still a great challenge for us to try to recruit and retain. So if anybody has any questions, I'd be happy to answer. I do know where you all are in the budgetary process. I truly understand, but I know everyone's is a crisis, but we're having a real hard time.
See, anyone have a question? Thank you.
Thank you very much, Mr. Chairman.
Dr. Geller. And next be Jeff Breedlove.
Good afternoon, Mr. Chairman, members of the committee. My name is Dr. Robert Geller. I'm the medical director of the Georgia Poison Center, which is the poison center serving the entire state of Georgia. We serve the people of every county. And for all those people who are in the hospitals, representing hospitals in the background, we serve each of you every year without charge to you. In the proposed budget, there was a cut in our proposed funding. The budget, as published, said $89,000. We were told that's an error and it's only $49,000. But $49,000 to us is matched with federal money and results in a cut to our budget of somewhere between $150,000 and $200,000. That cut results in us having to lay off people. If we have to lay off people, either people wait longer or we cut services. The service we don't have to provide according to our accreditation is rabies triage. Rabies triage says that if you were bitten by an animal, the question is, do you need to get rabies shots or not? Rabies shots cost between $10,000 and $25,000 per person. And for those who are uninsured or those who are insured by Medicaid, it's coming back to the state budget. We've been doing this for more than 20 years, and in a previous year where there was a shortage of the vaccine, we studied the impact of our advice on vaccine use, and we can tell you it cut vaccine use by 1/3 compared to what people would have done had we not provided the advice of no, don't give vaccine. If you figure that the state share of that cost is $2.1 million. So if you want to cut our $49,000, the state Medicaid budget will go up by $2.1 million next year. The other thing is if we take a further cut beyond that, which is proposed in the next budget, we will have less staff working, which means when people call, there will be a longer wait to get to talk to somebody. Some of those people will hang up and go to an ED. If they go to an ED, we will pay their Medicaid cost for that ED visit that probably wasn't needed, because 95% of the cases we get called about are managed at pre-hospital, i.e. they don't go to an ED, they don't further congest our EDs for things that didn't need to be in the ED in the first place. So the last thing I want to mention of things we do is we actually answer the phone for triaging state public health emergencies. So right now, if you call the state and ask with a concern about coronavirus, there's a good chance you're talking to our staff on behalf of them. We triage those calls, things that require the attention of a staff member directly at state, get sent to them. Things that don't, get reassurance, get documentation sent to them, but we save the people having to personally do that. When we had an Ebola outbreak and we were managing people, actually the Poison Center was managing most of those people and following up with them daily to make sure they checked their temperature on behalf of the state. If we don't have the people, we can't do that. So I'm asking that you maintain our budget without a cut. I'm happy to answer any questions.
Okay, we have a question for you. Representative Petrie has a question.
Thank you, Chairman. Dr. Geller, a couple of questions. First of all, what is how many staff work for the Poison Center?
We have about 50 employees total, including physician consultants.
Say that, would you say 50?
50.
50 employees. And what did you say further, sir?
I'm sorry?
You said 50 employees?
Yes.
And how many physicians?
That includes 7 physicians.
7 physicians. Okay. And how many calls do you get you mentioned you've got I'm looking at your information here about rabies triage.
So we have about...
So in Georgia, how many rabies calls do we get a year?
About 2,100.
2,100 rabies calls a year. Wow. Okay,
and
thank you.
As noted in this document, it's important to note that 2/3 of those calls occur outside of normal business hours. So this is a burden that is handled by the state, has to have someone on call 24/7 to do that. And by allowing us to do that, well, we already have people on call 24/7. 95% of the calls don't get back to someone at the state. They get handled by myself on the next level tier up, or they get handled by our staff. And so the idea is we save state money, we provide the same level of service, and we are able to utilize efficiencies.
Thank you, Doctor. And Dr. Geller, these 7 physicians, last question, they are, these are full-time physicians? These
No.
are part-time? They're on call? They're,
No.
how
So
does
we
that-
have-
Explain how that works.
Yeah. All the physicians are employees of Emory, full-time employees of Emory University School of Medicine. And in order to maintain 24/7, 365 coverage, all of them are partly paid by the Poison Center to take call, partly provide direct patient care, myself in pediatrics and my colleagues in the emergency department. All of our physicians are board certified in medical toxicology as well as their primary specialty.
Thank you.
Thank you, Mr. Chairman. Really, it's more of a statement. I'm from rural Georgia, and we have a little problem with snake bites, and your folks have been very good and on the spot, helping when we need them. Thank you. I appreciate that. We're going to need that.
Thank you very much for your compliment. We're glad to do that. That's what we aim to do across the state.
I do. Thank you, Mr. Chairman. Tell me again what the $49,000, I'm over here, Doctor, the $49,000 account for the total funds, both federal and state?
So $49,000 of state line item money is matched by FMAP money, Federal Medicaid Assistance Program administrative money, so it's matched about 3 to 1. So the 49,000 and change becomes 152. That money in turn is now matched by other federal money, so it becomes about 160.
So essentially, if we were to cut these things, you cut the people, as you said, I guess the phone just rings.
Well, we hope not. So the first thing we would do to try to maintain service quality is we would abandon the voluntary rabies animal bite program, which would reduce our call volume by about the number of calls a single person handles. So if we took a further cut beyond that, which is what was proposed in next year's budget, then we would have less people, and the wait time, which is currently 40 seconds, would go up.
Remind me next year's budget, what that amounts to, total funds.
The total impact on our budget, if as published, is $450,000.
Wow, thank you.
Thank you, Mr. Chairman. Dr. Geller, thank you for your presentation. Would you reiterate again what the Poison Center's role was or is in the Ebola virus and the coronavirus?
Yes, so we answer, the state has a public health hotline called 866-PUBHLTH. That call is actually answered by our staff. We operate pursuant to guidelines about what they want us to say and what the issue is the person's reporting. If you were to report, for the sake of argument, I think someone came back from Africa with a case of Ebola, we're going to wake somebody up. We're going to wake up Dr. Toomey or one of her leaders, even if it's Saturday night, to say, you need to deal with this. If someone's reporting, unfortunately, a case of gonorrhea or syphilis that are very common and not equally urgent, we're going to put that information on someone's desk for the next workday, and we're not going to wake them up. For coronavirus, what we're doing is when someone calls, we collect that information, we give it to the state, we can answer basic questions. If someone says, well, I came back from China and I was in Hubei province and I have a fever, that's something we're going to get in front of an epidemiologist right now, and they're going to follow up. If the volume of business goes up on that, we're going to wind up doing that as well, and we need more people to do that. And at that point, we'll need more money, not less money.
Thank you.
Thank you, Doctor. Let me ask you a question. The Georgian Poison Center, let me make sure I'm right. It's the only center of its kind in the state, correct?
Correct.
And you serve the entire state?
Correct.
Good. Thank you very much for your testimony.
Thank you.
Next up, Jeff Breedlove, and then Kathy Floyd. Okay.
Thank you, Mr. Chairman and members of the committee. I'm Jeff Breedlove, and I'm with the Georgia Council on Substance Abuse, and I'm also a person in long-term recovery. And for many years, I had the privilege for about 8 years to serve as a policy analyst here at the General Assembly. And I'm here today to talk about or on behalf of the over 800,000 people across the state of Georgia who are in recovery. Mental health and addiction services underlie pretty much everything we're talking about here today, and mainly because more people are dying in Georgia today from issues directly related to addiction and mental health than any other thing in the United States and in the state of Georgia. In 2018, 1,574 Georgians died of opiate overdose alone, not any other type of overdose or any other thing connected to the disease, just opioid overdoses. And that was an average of 4 individuals a day in our state in 2018. Back in 2009, the General Assembly made some cuts to programs that impact addiction and mental health services. We are only just beginning to recoup from those cuts. And in your wisdom and with your bipartisan support and the support of the past 2 administrations, we've had innovative programs put in place in Georgia. And Georgia leads the nation, not the least of which is in our peer coaches in hospitals across our state who are literally partnering with doctors and nurses, changing the culture in our hospitals, not only saving lives of people who are in the emergency room and women in the NICU, but reducing daily operating costs by thousands of dollars, especially in the NICUs. We have, thanks to your support, over 30 recovery centers around the state. Most of them are in rural Georgia. These, you might think of them as they're not treatment centers. You might think of them as a clubhouse where people go. These divert people from hospitals. These are places that are up and running across our state, and this is not the time to cut these innovative programs in our state. And I will leave you with just a few thoughts. If there's something killing more people than anybody else, we respect the reality of putting Georgia in a strong place in the future with our budget. But we believe that these programs save money in both the short term and the long term in our budget. We believe they save lives, they restore families, they make a stronger workforce in our state. When I served as the Deputy Director of the Governor's Office of Workforce Development, the number 1 reason why businesses had problem retaining a workforce was soft skills. The number 2 reason was a workforce that could pass a drug background check. Having these types of innovative programs supporting the mental health and addiction recovery community make a stronger workforce. So we just want to thank you for the leadership that you're exhibiting. It's a united front in the recovery community that not only should we be expanding our programs because of the epidemic and crisis that we're in with this disease, and make no mistake, it's a disease. We believe it is certainly not the time for cuts, and as transportation has been exempted, we would ask the governor and the General Assembly to help save lives by exempting any cuts to mental health and addiction recovery programs. And with that, I thank you for your time.
Thank you. Do we have any questions? Thank you, sir.
Thank you.
Next up, Kathy Floyd and Mary Lee Boatwright. And Quinn. Okay. Oh, thank you.
Thank you, Mr. Chairman, for this opportunity. I am Kathy Floyd. I'm the Executive Director of the Georgia Council on Aging, and I want to speak to you about the need for funding for Department of Community Health and Healthcare Facility Regulation. The Council has been working for 3 years on this issue, and it was because of an investigation that the Augusta newspaper did 4 years ago on the lack of regulation for personal care homes in the Augusta area. The Augusta advocates brought the issue to us, and we have been working on this ever since. The Department of Community Health licenses and regulates personal care homes and assisted living communities through their healthcare facility regulation. It surveys these facilities to assure compliance with regulations, and it makes survey reports available to the public. Consumers, when they are faced with having to choose one of these facilities, have a lack of information to make the best choices for their loved ones. Facilities with few violations can stand out as good consumer choices. Those with serious violation histories would become questionable choices. Unfortunately, a lot of good consumer information is not available for folks. In December of 2018, we sat down with the regulators and with providers, and DCH reported to us that they had 21 surveyors and needed 28 more to cover every judicial district. And they also cited the need for 7 additional staff positions to support the administrative hearings process and work with law enforcement on elder abuse cases. Without adequate surveyor staffing, inspection intervals are lengthened and publicly available reports become outdated. And again, if consumers don't have current information, they're handicapped in making their decisions for their loved ones. The recent investigation by the Atlanta Journal-Constitution of the private pay side of these homes lays out an incredible amount of evidence of the problems that we are facing with this regulation. And we think that it's incumbent on the legislature to react to all of this information. In his testimony to your committee, Commissioner Berry admitted that healthcare facility regulation has a challenge with their surveyor retention. He admitted that the pay rates play a factor and that high turnover is also due to the workload that they have. We think that the new rule that they put in place that facilities have to post inspection reports on their website, it could be helpful, but that's not, it's not a guarantee that they're going to put it somewhere that consumers can find it, that it'll actually even be there. It's a small first step. DCH has also updated their website with their reports. It is an improvement, but it's still not very user-friendly for consumers. It's very difficult to locate reports, especially if you're looking and you don't have a particular facility in mind, and you're just looking in your area to see what's available. Plus, how would a consumer know to go to this website? There's no steering, there's no consumer information steering them to this is what you need to look at. You'd have to be basically an insider to know that this is a resource that is available. The state's paper-based system of survey and complaint investigation presents quite a few problems and time delays. We would love to see this process automated and soon, not multiple years down the road. Also, we've been asking for transparency with aggregated data. We need to know what's trending as far as problems in these homes. Any kind of business uses a dashboard now to look at, what are my problems, what's going right, what's going wrong, and we don't have any of that. We can't look at how many homes were fined, how many homes had complaints, no aggregate data to look at and identify what are issues so that you can then try to address those issues ahead of time. So those are some other things that we think that should be looked at. I hope that The problems that this work has shown in the Atlanta Journal-Constitution incredible investigation does not get lost in the discussion of budget priorities. We know that we've heard from our consumers that people are afraid to go into assisted living now, and people are avoiding assisted living facilities and staying at home longer, staying in what may be unsafe situations longer because they're scared. And we really would like to see this legislature make a statement and show to consumers that these issues are being addressed. Thank you.
Thank you, Kathy. We've got a couple of questions for you.
Thank you, Mr. Chairman. You mentioned in the handout about transparency of
Yes.
data. Can you tell me what constituents in neighboring states have access to that our citizens are missing?
Well, Florida, for instance, has a readily accessible spreadsheet that shows you every home that has had a sanction, what the sanction was, the amount, and what it was for. It's readily available information right there on the Florida's website.
Thank you.
Thank you, Chairman. Ms. Floyd, as you know, I have been very aggressively asking the department about just this issue in every hearing I've had. And so, because the first thing needs to be said, and I know you know this, I hope you know this, the industry wants surveys. The industry wants quality surveys. The industry wants the department to be fully staffed, because that's how you keep out the bad guys that give the industry a bad name.
Right.
And I know you know that well. And this is an industry that's exploding across the state because it's what consumers want, and consumers are fleeing there in droves. So my question for you is this, though. I asked the commissioner quite pointedly on this yesterday, and he really gave a very good answer. What he said was that the issue isn't necessarily money, because I stand ready to help the department have whatever resources they need to make sure that we're adequately surveying. And what I heard was a really impressive answer from a man who was saying that you can't just throw money at it. It may be bigger than this. It may be the workload. It may be the culture of the department. It may be, he went on and described the maybes and suggested that they are looking into this. I'm glad they are. Because at the end of the day, what we want to know is that we've got adequate surveyors to protect the most vulnerable citizens in our society. So we want that. But right now, the challenge, I think, for this body is that, per the commissioner's statement, we can't necessarily just throw money at it and know that's going to fix it. Does that make sense?
It does. It's just that just a little over 12 months ago, they provided us with data that said that they were lacking as far as surveyor
on the skilled
positions.
nursing side, and I've quizzed on that too, because I too felt like they were inadequately staffed across the board, and what they've shown me is that they are not. Where they are inadequately staffed is on the skilled side. Now, interestingly enough, we have to also remember that the nursing shortage they're having is ubiquitous. It's not just the department, it's every hospital, it's every provider, everybody across the state is struggling to hire nurses. So they have similar issues. And so at any rate, I'm agreeing wholeheartedly with what you're saying. I want us to find a solution to this, but I think I just wanted to call attention to the commissioner's answer yesterday, because I thought it was a good answer, where he explained that we got to figure out how to make sure we are able to hire and retain. But it may just not be a matter of money. I just wanted to call your attention to that. Thank you.
I
Thank you for
appreciate
being
that.
here.
And I just don't want us to keep studying. I'm afraid that we'll come up in April on sine die and we'll still be studying. And that, I think, would be a huge missed opportunity.
Thank you, ma'am.
Thank you.
Next is Mary Boatwright and Quinn, and then followed by Brianna Lipscomb.
Good afternoon, Chairman and members of the committee. I'm Mary Lee Boatwright Quinn, and I'm the Director of Government Affairs for the Alzheimer's Association Georgia chapter. Thank you for the opportunity to speak on behalf of the Alzheimer's Association and Georgians living with Alzheimer's and dementia in support of appropriating funds to the Department of Community Health to address and improve the quality of care in residential care facilities across the state. I second pretty much everything that Kathy Floyd just said, and I'll tell you why. The need for care in residential care facilities will continue to drastically rise over the next 5 years as the senior population in Georgia is growing exponentially, and the number of Georgians living with Alzheimer's or dementia is expected to rise by more than 27% by 2025. As it now stands, 42% of those living in residential care facilities, which in Georgia means assisted living and personal care homes, have an Alzheimer's diagnosis. You might think that all 42% of those are in memory care. That's incorrect. Only 13% of those are in memory care. The rest are in the regular level of care and assisted living. This already staggering statistic does not include those living with any other type of dementia or those who have not yet been diagnosed. So we know the number is even higher. To ensure quality of care in these residential facilities amid the ever-increasing need, it is vital that the state fund solutions that do two things. One, ensure training and education for care providers is adequate, dementia-specific, competency-based, and ongoing. As it stands now, training requirements for care providers are inadequate in ensuring they have enough ongoing, competency-based, dementia-specific training to meet the unique needs of seniors living with Alzheimer's or another dementia. This sort of training should be required not only of care providers and direct care workers, but also the surveyors who are evaluating the residential care facilities. And number two, ensure adequate and transparent oversight of licensed care providers. I can tell you from our constituents that when families are needing to place their loved one with Alzheimer's outside of the home and give over that 24-hour care to somebody else, it's the hardest decision in the journey that they have to make. They should be confident that a setting licensed by our state is safe, dementia capable, and it is a place where their loved one can live out the remainder of their disease until they go to the next level of care safely. As this committee considers its funding priorities for this legislative session, I urge you to prioritize seniors, especially those living with Alzheimer's or another dementia, by appropriating funds to the Department of Community Health for the changes that are necessary to improve the quality of care in residential care facilities throughout the state. We commend this committee for its continued work and support in implementing the Georgia Alzheimer's and Related Dementias State Plan that the General Assembly put in place in 2014. The Alzheimer's Association Georgia chapter is committed to providing this committee support in any way that we can. And I also want to mention that I heard loud and clear yesterday from Commissioner Berry that he is wanting to hear from trade associations and stakeholders who have proposed solutions to improving quality of care, and I can assure you that I will be having conversations with him. So thank you for your time and allowing me to testify on this important issue.
Thank you. We have a question. Representative Hughley.
Thank you, Mr. Chairman, and thank you for what you all do at the Alzheimer's Association. But I have constituents who are having difficulty in finding a placement, period. And if they do have placements and they find that the placements are inadequate, there is no opportunity for them to move their loved one to someplace else because the current situation pretty much dictates the providers can choose their residence. What do we do about that?
That's a whole nother issue that I'd be happy to talk with you more about, because we've heard this story a number of times where unfortunately we call it dumping. You know, somebody is sent out to the ER and then it's said that they can't come back anymore, and that can happen. You know, the other issue is we have families who they have their family member who's gone into 3 or 4 different communities. They might not be happy in the first one, and they move them again and move them again, and those tend to be quality of care issues. So you point out something that we see each and every day with our constituents.
Thank you very much.
Thank you.
Next, Brianna Lipscomb, and then Laura Harker.
Good afternoon. My name is Brianna Lipscomb, and I'm the Senior Manager of the Maternal Health and Rights Initiative for the Center for Reproductive Rights. And I'm here on behalf of a coalition of more than 15 organizations comprised of concerned Georgians working towards improving maternal health outcomes in our state. And we recognize what a difficult task you all have, particularly with the budget cuts. Nevertheless, we are requesting first that you all protect any current maternal health funding or maternal mortality prevention funding that's been allocated to our agencies in the state. And while you all focus on ways to raise revenue, we ask that you also make provisions to extend Medicaid in the postpartum period. Implementation of this policy would be one of many necessary steps to addressing the maternal mortality and morbidity crisis in Georgia. I think we all know that data has shown that Georgia has the worst maternal mortality ratio in any other state in this country. And our own health experts in Georgia believe that more than half of the confirmed pregnancy-related deaths in the state are preventable. And based on the latest report from Georgia's state-mandated Maternal Mortality Review Committee, 82% of maternal deaths occurred in the postpartum period, and that is up to 1 year after delivery. Yet women enrolled in Medicaid for pregnancy lose coverage after only 60 days. Extending Medicaid coverage of moms to 1 year after they deliver will ensure that they have the access to critical health care services and demonstrate that Georgia values women's health. This recommendation has been made by both the State Maternal Mortality Review Committee as well as the General Assembly's own recently convened Special Study Committee on Maternal Mortality. We acknowledge the great strides that have been made over the past few years to improve maternal health in Georgia. And we urge you all to continue proposing and passing legislation that creates opportunities for women to achieve their optimal standard of health. These opportunities start with access to safe and respectful health care. So once again, we just ask that you please protect current maternal health funding and that you allocate funds for the extension of Medicaid in the postpartum period for up to 1 year. Thank you.
Thank you. Any questions from the committee? Thank you, ma'am.
Thank you.
Next up, Laura Harker, and then Brian Ginn.
Good afternoon, Chairman and members of the committee. My name is Laura Harker, and I'm the Senior Health Policy Analyst at Georgia Budget and Policy Institute, and we are focused on research that is focused on increasing access to care. Some of our 2 top priorities that we're concerned about in the budget, number 1 is our work around increasing the provider workforce across our state. We've been following that progress in recent years, including different types of healthcare providers and those loan repayment programs, and increasing our investment as a state in graduate medical education. And we're excited and encouraged to see that there are at least some new residency slots that are continuing to be added to the healthcare workforce budget. However, we're concerned about less funding going to those medical school operating grants and those loan repayment awards for rural areas, and concerned about how that can affect some of the progress we've made thus far. Additionally, some of our priorities include mental health care, and as we all heard earlier, there's concerns about some of those cuts to mental health and substance abuse services, and we understand the department prioritizing those crisis services, but we do have some concerns that those core behavioral health services that are available are really a way for us to get to people earlier and get them treated before they do reach crisis. So it's important to retain those core services. And lastly, on public health, we're concerned about the cuts to the local health departments, and I know we heard some context earlier yesterday in other meetings about how some of the health districts are looking at not filling vacant positions as one way to absorb that, and that is good that there's no existing positions that may be affected, but we are concerned that that could overload some of those existing employees and just generally affect capacity overall, especially in smaller counties where those cuts could be felt in worse. And so lastly, I know we are looking at revenue options to address some of these cuts, and we have done some research, our organization, on the tobacco tax, increasing that by at least $1 a pack, which also has health benefits for preventing youth smoking, and we're also open to talk about other revenue options as we look at the need to fund other important priorities such as the Medicaid pregnancy extension, which we also support. So that is all from me.
Thank you.
Thank
Any
you.
questions from the committee? Thank you, ma'am. Okay, next up, Brian Ginn, and then Nancy Paris.
Mr. Chairman, members of the committee, I am Brian Ginn. I am privileged to serve as the Chief Campus Officer at the Philadelphia College of Osteopathic Medicine, which has campuses in Suwanee, Georgia, Gwinnett County, and now, as you are quite aware, down in Moultrie, Georgia, in Colquitt County. On August the 6th, Mr. Chairman, many of you were able to join us with about 650 other citizens from the rural communities of Southwest Georgia as we cut the ribbon on Georgia's newest medical school, a full 4-year medical school that will be educating per class for the next 4 years, 59 osteopathic medical students in the heart of rural Georgia, where their need is, as we all know, significantly great. We've made an investment as an institution of over $25 million, and the local community has invested significantly with millions of dollars in local support as well. As we go forward with that campus, we would like to grow other academic programs. We've all known that there's a significant need for mental health academic programming as well. There's a limit to what we can do. So as we continue our efforts, we look forward to working with members of the General Assembly and identifying ways that we can continue to partner with the state. In specific, I was asked to talk a little bit about the reductions and the cuts that might be coming forward, that have come forward and might be coming forward. Through the capitation, student capitation for Georgia citizen student funds that you provide through the Georgia Board for Healthcare Workforce, we did sustain a $45,000 cut in the current fiscal year, and should the continuation funds go forward as existing now, we would sustain a $75,000 cut. The impact of those cuts would delay the build-out of a smart classroom at our Suwanee, Georgia campus, delay computer upgrades in our simulation laboratory in Suwanee. It will limit the scope of build-out of additional bench lab research space in Suwanee. It would delay purchase of additional high-fidelity simulation equipment on our Moultrie campus, and that we've already seen great community support in using, community engagement in using that facility with EMTs and local first responders coming and taking advantage of the simulation site there. And it would have a potential reduction in the funding available for hiring standardized patients, which are critical in the first and second year of medical schools students' educational curriculum. We appreciate the support that we have received from the state of Georgia. We are using the funds you provided to us as a operating development grant, if you would, for pipeline programming as we agreed to. We've had, I can't begin to tell you the number of local high schools and local colleges in the region of Southwest Georgia and South Georgia that have come to our campus down there already, taking advantage of understanding the pathways to healthcare professions. So we're working diligently to ensure that we're focused on the mission. We are unable, though, Mr. Chairman, to defray cost of student tuition, as other medical schools in Georgia are able to do for Georgia citizen students with significant state support. So we appreciate the consideration of this committee and the General Assembly as you continue to grapple with the challenges that you face, and we appreciate the support of this body.
Thank you. Any questions from the committee? Thank you.
Thank you, Mr. Chairman.
Well, excuse me, I'm sorry. Question? No.
Sure.
Does your school participate in the accelerated program for physicians down in Moultrie?
We do not. It's a 4-year, when you say accelerated, a 3-year program, ours is a 4-year program down in Moultrie. We've actually looked at that. The price points, cost factors associated with that are not insignificant.
But if we funded it for you, you could get more doctors out faster, I suppose.
We would welcome the opportunity to have that conversation, Mr. Chairman.
Remind us, I went down when you did the ribbon cutting, and I think there are 51 or 59 students in that first class.
Yes, sir.
How many applications did you have?
For that inaugural class, Mr. Chairman, we received over 3,000 applications. On our Swanee campus, we receive over 5,000 applications per year.
3,000 applications for 51 slots. That's pretty competitive.
Thank you. A lot of interest. Thank you, Mr. Chairman.
Okay. Next, Nancy Paris, and then Stan Jones and George Ray.
I'm Nancy Paris with Georgia Corps. I'm here representing our organization and also our partnership with regional cancer coalitions of excellence across the state. Thank you for this opportunity. I thought I'd spend a couple of minutes telling you about some good news because you all have been really good to the cancer community, helping us identify both problems and opportunities. And when we spoke with Chairman Parrish last week, we were able to share how we're moving the needle on some of these serious problems that many of our families have encountered. So when we receive $500,000 in tobacco settlement funds for development of a clinical trials network, that funding has been stable for a number of years, and the accomplishments that have come from this have benefited thousands of Georgians. We have the latest clinical trials in the state. We have hundreds of physicians who provide these new treatments to their patients, and we have a statewide database so that everyone can access information. Also, we were able to secure this year an $11 million 6-year grant from the National Cancer Institute for the research network that Georgia Corps operates, and Augusta University also received a multi-million-dollar 5-year grant for their research network, which focuses on reaching minorities and rural populations. Had we not had stable funding to develop the infrastructure, the partnerships, and the outcomes in the way that you all guided us to do, we would not have those programs. And in addition, the letters of support that came from our network assisted the Winship Cancer Institute in receiving their designation as a comprehensive cancer center. That's a great success, and we thank you for that. I want to tell you about another opportunity we have, and this one brings the regional coalitions into it. You know, as members of the committee, that we have a Georgia Cancer Plan, and we work together, 88 partners, to develop and monitor outcomes and report to you. One of the reports that you have in front of you talks about how we see need and opportunity coming together this year to take some steps forward that are dramatic. One is in the realm of colorectal cancer screening. Yesterday, our coalition, the Cancer Consortium, the regional programs, the federally qualified health centers, the Department of Health, Georgia Corps, submitted a letter of intent to CDC for a grant to enhance colorectal cancer screening. And I want to tell you that sometimes we come to you and say Georgia's at the bottom of the barrel here, or maybe we're midway, but with regard to colorectal cancer screening, we are above the national average but not yet at the Healthy People 2020 goals. We have programs across the state that can very cost-effectively screen and identify colorectal cancer early and get people into treatment through our regional programs that have navigation to do that. And the CDC opportunity is up to $900,000 a year for 5 years. Without your investment of state dollars in the regional programs and in Georgia Core, we would not be positioned to compete for this. And we'll turn this proposal around in 5 weeks and hope to give you the good news that Georgia's been awarded this grant. Our experience working in rural communities and serving racial and ethnic minorities and underserved populations in urban centers is extraordinary, and we believe that's why we've made such progress with colorectal cancer and that we're seeing good results, excellent results, in fact. Now, the recommended cuts would be $143,000 a year for Georgia Core this year, and about $300,000 next year for the regional cancer coalitions, which, as you're thinking about these tough choices you have to make, just see, does that amount of money really offset the benefit in health and life expectancy that we can provide for Georgians? And if you have any questions, I'd be glad to answer them, of course.
Good.
Thank you, sir.
Thank you. We do have a question. Representative Petrie.
Ma'am, this is indeed good news. When I'm looking at some of these graphs, which are fantastic, we've all been affected by cancer in our families, and I'm looking here at the plummeting trend on colorectal cancer, which you just alluded to, but also with lung cancer. So tell me about just help me understand, we've seen a tremendous drop in lung cancer.
Yes.
And what do you attribute? I mean, obviously, I'm thinking lower rates of smoking, but
yes.
Can you speak more fully to that?
Yes, and I think some people here are very interested in this subject. So indeed, we know the health risk of smoking, but we also know that lung cancer is caused by many other factors, not just smoking alone, and we want to be careful not to limit our thinking of the causes just to smoking. We do believe that smoking cessation is critical, and we do believe that an increase in tax on tobacco can reduce consumption and provide revenue for some of these vital programs. Early detection is vital. We know how to screen for lung cancer now through spiral CT scan, and we have a lung cancer roundtable of professionals that works together to demonstrate best practices that are implemented across the state before patients show up in the emergency room or in critical care. So we do have a good strategy there. I'm sorry, you asked me another part of it.
No, that was helpful. That was
Okay.
great news. And the colon cancer, really the screening, and you just mentioned how
Yes.
well we're doing there. That our dramatic decline there could be attributed to that, I think, is what you're
Very
suggesting.
definitely, and we also use a variety of modalities for screening. It doesn't have to be colonoscopy done by a specialist. We use, FIT screening and other types of recommended screenings so that patients can be monitored very effectively.
Thank you.
Thank you, Mr. Chairman. Thank you for the presentation. Can you speak to what you all are doing to address the disparity in breast care diagnoses?
Yes, ma'am. Thank you for asking that question. So one thing we have learned in our research about cancer, which you all do not fund, that's funded nationally, but it's very important to know, is that cancer is not one type of disease, and even breast cancer is not one type of disease, and it does not affect white women and African American women in the same way. In fact, Black women have a much higher incidence of mortality from breast cancer than white. We convened a panel of researchers at a recent meeting, a January meeting, for oncologists to hear what the research says about this. And it does seem that there are different genetic types of cancer, but it also seems that the compounding factors of stress. We've heard about mental health issues. We've heard about socioeconomic pressures. We all know about discrimination. We know about geographic and rural and racial disparities. These are all things that have an effect on health outcomes. You were in the Women's Caucus meeting, and we heard one of the representatives talk about not wanting to get a mammogram because of the pain, and we heard another lobbyist talk about delay in receiving mammography because of fear and apprehension. Those are all compounding factors. I think the important thing is that we're conducting research, we're monitoring the trends, we're talking Black women, white women, brown women, Asian women about these issues, and the physician community and the researchers are very attuned to this issue. We just can't say that it's one thing. It's not only access, even though we support that. That's not all there is to the story. It's more complicated.
Thank you. Thank you, Ms. Chairman.
Thank you very
My
much.
time's up. Yes, sir.
Okay, next up we have Stan Jones and George Ray, and then Emily Yana.
Thank you, Mr. Chairman, members of the subcommittee. My name is George Ray, and I'm with the firm of Nelson Mullins, and along with Stan Jones and Helen Sloat, we're pleased to represent the Easter Seals Coalition of Georgia. I appreciate the opportunity to speak to the subcommittee briefly today about one particular program that Easter Seals runs across the state for kids and families across the state, and that is the Champions for Children's program. Members of the subcommittee, you'll probably remember that program, but it's located within the Department of Community Health, specifically the Healthcare Access and Improvement Program. This program is administered by Easter Seals affiliates across the state, and all dollars that go into the program go directly to services. The administrative costs are absorbed by Easter Seals so that the state and Easter Seals can provide stipends to families of medically fragile kids who don't qualify for the Katie Beckett waiver. And that is a $3,000 annual stipend to those families to pay for things like medical costs, specialized food therapies, equipment needs, and other essentials that allow the children to stay at home rather than be in skilled nursing or other types of facilities. We're appreciative of the subcommittee and of the General Assembly's support last year in helping fulfill an additional need in that program with an add into the budget. There continues to be need for providing services to these kids and to these families. There are 400 families who were recently denied the Katie Beckett waiver. That created additional demand for these stipends, and we'd appreciate any support the subcommittee would offer in helping to serve those families. So happy to answer any questions with Helen if we can do that.
Thank you. Any questions from the committee? Okay, Representative Hawkins.
For Katie Beckett, how was that going?
So I'll defer to Helen. She didn't think she was going to come up. She is the subject matter expert. I just get to be the friendly face today.
Okay.
Good afternoon, subcommittee members. The way the Katie Beckett program works is a family has to actually make an application, and then there's a determination made that the child does not meet the medical necessity requirements. So then they can take that denial and then apply for the Champions for Children funding. So the Department of Community Health has to make that determination.
Right. But once they qualify, are they having to reapply?
On the Katie Beckett,
Katie Beckett.
To be quite honest, sir, I'm not really sure how that works. It used to be that way, I believe, that you had to re-qualify for that program, but I don't know if they've actually now changed the requirements on that or not. We can certainly look into that.
Would you do that?
Sure.
Yeah, because they said they were going to change that. It's sort of silly to have these families reapply when you've got a spinal bifida child who's never going to get out of the wheelchair.
Right.
Yeah, okay.
We can certainly look into that.
Thank you, I appreciate it.
You're welcome.
Thank you.
Thank you.
Okay, Emily Yana and Andy Lord would follow her.
Thank you, Chairman Parrish and members of the committee. My name is Emily Yana, and I'm the Director of Health Policy for the Georgia Dental Association. First of all, I wanted to take time to thank you guys for all the money that you've allocated for dentistry. I know there are a lot of advocates on this committee
for dentistry, and we really appreciate that. We also appreciate you taking the time to, advocate for placing the money back in the budget that is misplaced, especially with the student loan repayment. According to the American Dental Education Association, the average debt that dental students are leaving with is over $292,000. So we really appreciate you considering that, and as well as the malpractice assistance program. We are here today to ask for 2 budget items. We know that it's a small budget and that you guys are experiencing cuts, but we believe these are essential for children in Georgia. One of them is the incremental fee increases for 10 of the most utilized codes for children. We've been getting incremental fee increases for the last 3 years, and we really appreciate it to this committee and all of the legislature. But these, we're still far behind. These Medicaid rates are about 42% of average dental rates. And so it's important that we come here and ask you today for that. The other code that we're asking for, we're actually asking to appropriate money to add a procedure to the dental Medicaid program, and that is silver diamine fluoride. And that is actually a type of fluoride varnish that you would paint to teeth, and it actually arrests the caries, so it'll stop cavities immediately. There are currently over 35 states that do include silver diamine fluoride as a procedure in their Medicaid program, and so we're asking for this to be considered this year. Like I said, we're just thankful for everything that this committee and the legislature's done for dentistry over the last few years, but we're here to ask for that as well, so thank you.
Thank you. We have a question for you, Representative Hughley.
Thank you, Mr. Chairman. This special thing that you put on children's teeth, what do you anticipate the benefit would be if we did that?
So we actually did a cost analysis, and it's pretty difficult to do considering it's not a code here in Georgia, but based on research from other states, we did a cost analysis on this, and if you took 50% of the procedures that are currently receive restorative procedures like fillings and placed silver diamine fluoride on the tooth, you could save quite a bit of money. We're estimating that it would cost the state $2 million to add this code, but the potential savings for the state is over $6 million. So, and it's also, I should note, the American Academy of Pediatric Dentistry also recommends this type of fluoride varnish for children and even adults with developmental disabilities. The idea that you don't have to drill is great. So it's literally, the application's easy, and that's one of the positives as well.
Thank you.
Thank you.
Andy Lord.
Good afternoon, Mr. Chairman, members of the committee. My name is Andy Lord. I represent the Sickle Cell Foundation of Georgia. Wanted to first thank the committee for the appropriations that have already been rendered, and Chairman Parrish in particular. You've been had a very open door policy, and we've been very appreciative of the opportunity we've had to meet with you about this and the support of this committee. I wanted to quickly define sickle cell. I don't want to presume that everybody knows what it is. Sickle cell is an inherited blood disorder that's characterized by acute attacks of pain, anemia, swelling, bacterial infections, and stroke caused when red blood cells do not operate properly. Life expectancy is greatly reduced, and chronic pain is a lifelong condition of sickle cell. It is a very painful, very chronic, very serious disease. Most folks understand sickle cell is an almost entirely African American genetic disease. About 95% of sickle cell diseases affects just the African American community. I am an exception to that. I have sickle cell trait, which is how I've become involved with this, but it is almost exclusively an African American disease. What most folks don't understand is also disproportionately a rural disease. About 60% of the cases in Georgia come from rural areas. In many cases, folks are having to drive an hour and a half to 2 hours one way for an appointment to a specialist. And notably, Georgia has the 4th highest incidence of sickle cell disease in the United States. So it's very prevalent in Georgia, and in fact, there are more folks with sickle cell in Georgia than there are with cystic fibrosis and hemophilia, for example, combined, though those other two conditions have much greater access to specialty care than sickle cell does. It is for these reasons, our very high incidence and our urban-rural divide with regard to access, that the Sickle Cell Foundation has requested funding from this committee before, which has been granted. I'm very happy to report that we have used that money in very specific ways. One of those ways is that we have established sickle cell offices in the largest areas of incidence in Georgia. So we've established physical locations with this money in Savannah, Columbus, Augusta, and Macon. Those are the most concentrated areas. Those are also the urban areas. As I said, that 60% of this is coming from rural areas. So what we did with other portions of the money was we established a mobile sickle cell testing unit. This was designed to go after those 60% in the harder to reach areas. We can literally take the testing to them, the testing, the screening, the follow-up, the access to physicians. We have a traveling hematologist that we put on this RV, mobile testing unit, and we send them around the state to do testing in these very low access areas. That is a direct result. That is directly funded from the funds that this committee and that this body have allowed us, as are the 4 satellite centers that we've established. Lastly, just in this last year, we have done 4 very large physician trainings. We've done those in Emmanuel County, Richmond County, Chatham County, and Bibb County. The reason physician training is so important is that there are many physicians who still don't understand sickle cell disease, as hard as that may be to believe. Again, I'm an example of that. I was born with sickle cell trait. I did not know that until my son was born, because when I was born, they did not test for sickle cell in the metabolic screening. We expanded the metabolic screening in Georgia to include every live birth for sickle cell. So they caught it with my son. My wife and I then had to go get tested to see which one of us may have passed it on to him. So I literally lived much of my adult life not even knowing I had the condition. There are many other Georgians that that also don't know. I also meant to note that with the mobile testing unit itself, we have screened, we can document this, we have screened over 100,000 Georgians with that mobile testing unit. And out of those 100,000 that we screened, we have detected over 10,000 cases of sickle cell disease where the patient didn't know they already had it. So this has been very effective. We're in the metro areas with brick and mortar sites. We're in the rural areas with our RV. We are asking this committee to restore the cut of $265,000 that was made in the governor's proposal. That cut represents about 53% of what our total allocation was. So we really feel that at these satellite centers and with the RV. So with that, the only other note I would like to leave everybody with is next year marks the 50th anniversary of the Sickle Cell Foundation of Georgia. We were established in 1971, and we plan on having a big celebration here at the Capitol for that next year, and look forward to inviting you all to that. That's all I have, Mr. Chairman.
Thank you, Andy. We have a question for you, Representative Hughley.
Okay.
Thank you, Mr. Chairman. I just want you to know that I have heard from my constituents in Columbus as a result of the cuts to this program. They were anticipating helping more people in our area, and they are no longer able to do that. So this is something that's very important. And when they talk to me, I'm going to talk to you, Mr. Chairman.
Yeah.
How about that?
And we did, we had our lobby day last week, and we did actually bring our mobile testing unit here to the Capitol. We parked it right here between LOB, and a number of you were able to come not only tour the mobile testing unit that we have, but many of you all went ahead and got screened and had blood drawn, so we appreciate that.
Thank you. I've also heard from one of my constituents, Representative Williams, out here on a regular basis about this. Andy, thank you very much. Appreciate you being here. This concludes everyone that I had on my list. Is there anyone who signed up that I didn't have your name on my list? Okay. We've had a goodly number of representatives that have been in and out listening to this today. And while we're here, if any of you would like to have anything to say, we'll take a few minutes and hear from you if anybody would like to be heard. If you will touch the button there so I can, I knew you wouldn't pass up that opportunity.
Thank you, Mr. Chair, but I know you were shocked that I pressed my button. But I did want to say, particularly about sickle cell, a disease that I was not overly familiar with in my younger years, but I've become very familiar with it in the later years, being here in the legislature and listening, and then finding out how many people in Liberty County have suffered through the years, and in conversations with Representative Frazier and other people that are very familiar, I do know that there are about 8,000 Georgians. On the grand scheme of things, out of approaching 11 million, that's not a lot of people. But I had the unfortunate duty to attend the funeral of a friend's brother this past summer, who was 44 years old, which was rather old to have suffered with sickle cell all his life. And it's a terrible thing that they don't make the headlines, and I told some folk, they're not the ones, the patients themselves, that constantly knock on your door. A lot of them have no idea what we do here in Atlanta, and they're the ones that need us the most. And I feel very passionate about this, and if anything has bothered me during 18 years here, it has been this situation with sickle cell and the amount of money proportionally that could be such a help to people that suffer all of their lives. So whatever this committee can do would be greatly appreciated, particularly for rural Georgia.
Thank you, Mr. Chairman. I'm State Representative Gloria Frazier, and I am a true advocate for sickle cell, as you all know. And I would like to say thank you for your continued support through the years for sickle cell. We are at a point now with sickle cell disease where we are making great strides. We have 2 new drugs that many of you might not be aware of for sickle cell, and they are done with the trial studies. We actually have many sickle cell patients on one of the new drugs called Abiva, which is out now, and the patients are doing excellent. A lot of them are back in school, and a lot of them are going to work full time. So we have made great strides in these last few years, and we don't want to stop it now by taking additional cuts. The healthcare workers that we provide, that you all provided the money for the last 4 years, have brought a lot of these patients and got the services that they needed that otherwise they would not have gotten. We have rural hospitals that have closed. We have many patients now that do not have to go to the emergency room for morphine. They are now being able to have access to this drug, and we're just trying to make sure that this drug is affordable for everyone that lives with this dreadful disease. So we'd just like to have your continued support, and if we could get the money restored in the budget, the $265,000 that would keep our healthcare workers continuing to help sickle cell patients across the state. Thank you.
Thank you, Mr. Chair. I'm Representative Jasmine Clark. First, I want to acknowledge the opportunity to speak to the committee, and also to acknowledge the difficult decision that it is to have to go through this cutting budget and deciding where to make cuts. One of the recurring things I heard today from multiple people was about preventative measures, and I truly believe that when we invest in prevention in different types of ways. Not only do we save money, which is the goal of the committee, but we save lives as well. And so as y'all are making these decisions, you're going through and you're deciding what needs to be cut, I would just like to reiterate that preventative measures, screenings, things like that, those things are really important. And I do think if we think long term, those things would actually save our state a lot of money and also have the added benefit of we get to keep more of our friends and family around. Thank you.
Thank you. I want to thank all of our fellow House members who joined us today, who are not on the committee. Thank you for your interest. It shows that you're interested in what's going on up here and you want to try to learn more about it and see how we can address some of this. I also want to thank our presenters who took the time to come down and share some good information with us, and all of the folks who were in attendance with us. I think, as you can see, that we have a lot more work to do. There are many needs that were expressed here today, and the problem is they're legitimate needs, but we have limited resources with which to work. So thank you all. Let's just stay tuned as we work through the process. Was there someone else that I overlooked? Yes, ma'am.
Thank you. I'm Sherry Williams, and I'm with the New Georgia Project. And I have a short personal story that I would like to tell you about healthcare. I've had breast cancer 4 times. And the reason why I'm standing here is because of early detection. I do not have a family history. I've never smoked. I don't have any of the pre-existing conditions that would lead a person to have breast cancer. Without early detection, I would not be here. The first diagnosis I found, the first diagnosis the doctor found, the other 3 I found because I was educated to know what to look for. And earlier, Nancy and some other people talked about what's going on with cancer screenings. White women are diagnosed more, but black women die more. And it's because by the time most black women get access to health care, they are in the late stages, which means they already have 1 foot in the grave. Preventive measures save money and save lives. So I know we have limited resources, but when you have an increase in the number of late stage cases, they cost the state more. Expanding Medicaid would save the state money, and it would allow more people to have access. And it would also keep them out of emergency rooms when they have complications once they are diagnosed in late stages. So as you are looking to figure out how to deal with limited resources, keep in mind the quality of Georgia residents increases productivity within all other areas of this great state. So please keep that in mind as you realize that early detection really needs funding. Thank you.
Thank you, ma'am, and thank you for taking the time to share that with us. One last representative that just snuck in under the wire. She's still upset with me from the other day that we didn't get to hear from her. I do. Come on. Come on.
All right. Well, first of all, I really do appreciate having the opportunity to come before this distinguished committee. Obviously, this is one of the most important committees that we're dealing with because of our health. Without your health, you have nothing. A young lady, she may have left now, but Brianna Lipscomb, she talked about some of the issues I wanted to talk about. She brought to the Chairman England, a letter that was signed by at least 15 organizations throughout Georgia that had an interest in the issue of maternal mortality. And as we know, African-American women die 3 to 4 times more than any other race. And even though sometimes I think in life, if you keep saying it too much, it begins to be something that people hear, and then it goes off of their head. But what we're really talking about is an epidemic. And I really wish I could figure out a way to message it stronger and better so when I say it, people can understand it, because right now it's like, oh yeah, black women die 3 times, 4 times. Oh yeah, you're right, and people shake their head. But I'm really not for people to shake their head. I'm here to see a way that we can put this as a priority in the state of Georgia and make sure that lives are saved throughout the state of Georgia. And really, it sometimes affects, obviously, people in rural areas because, as you may know, the gynecologists, not as many, maybe half the counties even have GYNs, and rural hospitals closing. So what we have created, in not by choice, a perfect storm. We have a perfect storm in the healthcare system in Georgia, because you cannot have a health system that women die at childbirth, whether they're white or anything. You cannot have a health system that women die at childbirth, number one. Sometimes when we say, Mr. Chairman, we say this about them dying at childbirth, and people think, okay, they died, they had the baby and they died. No, it's like it's been stated before, it's, they may die, the recording of the data is up to a year, and that's why obviously House Bill 693, which was a recommendation of the study committee, and I see both Carolyn Hughley and Blinsa Stovall served as African-American members on that committee, and that was something that I was very instrumental in making sure did happen, because we wanted to make sure that people that are affected have some input in it. But what we're thinking about with this situation is, if a woman dies at childbirth, within that 365, the thing is, she also may have children at home. So not only now have she died and that child may have lived, now you may have 3 or 4, or maybe at least that person, they have siblings. So then you tell me that we're gonna put all the children in foster care? So it's not just a simple thing of she died at childbirth, she didn't have no more children. She died at childbirth and she got children at home. And so now all of those people go into the system, so you're gonna either pay for it on the front end, or you'll pay for it on the middle end, or you pay for it on the back end. So I really come with a sense of urgency, and I appeal to women of color, but to be honest with you, today I appeal to white women. Y'all gotta fight with us. Y'all can't just say, yeah, you're right, Mabel. I need white women to stand up with women of color and say this is an epidemic, and let our voices collectively be heard. Because right now, it's just a shaking of heads. People, y'all give me, I love y'all, but y'all give me shaking of heads. I need more than shaking of heads right now. I need a collaboration. I need a demonstration. I need an uprising, and I need some money in the budget.
Thank you, Representative Thomas. Thank you all for being with us today. We appreciate it, and the meeting is adjourned.